Hello, this is Brian Casey of the Imaging Wire. We are here at SIIM 2025, the Society for Imaging Informatics in Medicine. And we're here in the booth of PocketHealth. We've got with us Rishi Nayyar. He is co-founder and CEO of PocketHealth. Rishi, thanks for being with us today.
Hey Brian, great to be back on.
Yeah, good to have you. So we talked at RSNA in Chicago. Can you tell us a little bit about what's been going on at PocketHealth since then?
Definitely. We're here at SIIM 2025 to talk about two big new pushes we're making. The first one is very exciting. There's a lot of buzz in the show about this problem of incidental follow-up management and sealing that up. We've launched PocketHealth Follow-Up Navigator, really interested in showing that to a lot of folks here at the show today. And we've also launched Physician Hub, where we're spending time really rethinking the referring physician experience, how they access images, and going deeper down that pathway in terms of how can we make that performance better and faster. But really, honestly, it's follow-ups today at SIIM.
The follow-up issue is such a problem. This is where somebody goes in for a screening exam or maybe even incidental finding, and the radiologist makes a note of that in the report and says, somebody needs to follow up on this. But the numbers where this is not happening are astounding.
Yeah, it's something like, and this is from a SIIM study, something around 15 to 20% of radiology reports have a recommendation for a follow-up. And then I think most stunningly, 60% of those recommendations are not followed up on. And that comes from a lack of care coordination, the patient not being looped in, the referring physician not being looped in. And we see this trend continuing to go up over time as the demand for imaging exams continues to go up and up and up, so the number of incidental findings increases, and also because of just how overburdened referring physicians are, who are that in a traditional environment the last safety net for an incidental recommendation to be followed up on.
Yeah. And so how is PocketHealth addressing that follow-up issue?
So of course you can't be at SIIM without talking about AI. AI has the potential to completely revolutionize how we solve this problem. We focus on building a system that is able to intelligently detect these follow-ups, categorize them, and that categorization, which is a challenging problem technically. We think we do a really good job about that. Even if something's hedged or it's a clinical recommendation, we put into a work list. We loop the patient in critically. We loop the referring physician in, and we're able to make sure that these recommendations, of which traditionally the majority are missed, actually happen.
Very good. Now, patient engagement is also something that you guys do, and can you talk a little bit about what that means and what some of your solutions for that are?
Definitely. Patient engagement needs to go deeper than just the patient portal. So we spend a lot of time thinking about the critical role that imaging plays in the patient journey. So we built PocketHealth Patient Connect to seamlessly integrate into Cerner, into Epic, and meet patients in their EMR where they're naturally going anyways, to pay bills, for their appointment reminders, and a whole host of different features and functionality. We've then decided to use the latest advancements in AI to help patients actually understand their records and then move on to next steps. So patients go on to PocketHealth within their portal. They can understand the reports. They can look at the imaging, understand the imaging in context with the reports themselves, and critically understand what are the next steps and be really well equipped for the referring physician conversation after that.
Yeah. Now let's talk a little bit about image exchange, because that's kind of your origin story, right? Where you guys came from, which is the difficulty in getting patients their images, because it used to be done on CDs, and nobody's got a CD player anymore. What's going on in image exchange at PocketHealth right now?
Really, we think about image exchange in two fairly distinct categories because they really are different. One is that high volume sharing. Think of your large site communicating imaging results or vice versa, imaging studies to a co-located or very regionally close located large system where you're moving studies back very rapidly. In that use case, we're spending a lot of time making sure that performance is better than anything else on the market without having to pre-cache. The rules are really easy to set up, and that you can install these edge devices or these spokes very, very, very quickly with minimal steps in between. Then there's the last piece, which is the low volume sharing. This is where you're sharing with the long tail of all users of imaging. It could be the doctor in Milwaukee to the orthopedic surgeon to these other health systems that you rarely communicate with. And we spend a lot of time making it so these no network shares, things like emails via PocketHealth, access pages via PocketHealth work, they're seamless, they're secure, and they have the education built in. So these healthcare institutions actually accept it. And that's something we've done a really good job at, but we do think of these as two distinct problems and have really focused on being competitive in both of these areas in very different ways.
What else can we look forward to seeing from PocketHealth through RSNA?
We're really, really focused on continuing to use AI across these two key use cases that we've identified. One is how do we move images to where they need to go? And two is how do we fill in the gaps in the patient journey? And that means using AI to solve problems like incidental follow-up management that we've been talking about, helping patients understand their images better, not just their reports. It's really exciting to be in a space where now we can talk about images finally and connect that together. And just going deeper down the rabbit hole from that perspective with patients and then with referring physicians as well, who have been largely neglected in this AI journey and are desperate need of support there. So, we have a lot of exciting stuff coming out over the next few months leading up to Chicago.
All right, we'll look forward to seeing it. Rishi Nayyar of PocketHealth, thanks again for being with us.
Thanks, Brian.
All right, signing off from SIIM 2025, my name is Brian Casey.